Hi everyone, this is Dr. Singh. I'm an internal medicine physician. I'm also a nephrologist, which is a specialist who deals with kidney problems. I practice in Las Vegas at a Healer, and also I'm the medical director of Rareby Medical Spa. Recently, I had a client who had some symptoms where he was just not feeling great after a climax, uh, and he wanted to know what was going on. And I told him that he possibly could have post-orgasmic illness syndrome, and he had never heard of it, and I wasn't surprised. This is not something that is commonly discussed. Many providers are not aware of it. I recently wrote a blog on it as well on our website, and I still get a lot of questions. So I thought I'll update this with a little bit of any new data that is available. So, what is post-orgasmic illness syndrome? Uh, so most of the time, we're talking about ED issues, premature ejaculation, sometimes delayed ejaculation. But nobody talks about POIS because this is just so rare. Most people have never even heard of it. There's no test for it, so it's only a clinical diagnosis. Now people who do have it, they have huge issues with their quality of life, and they really struggle because there's not much information out there. So the symptoms of this typically happen just a couple of minutes after a climax or orgasm. Sometimes can take a couple of hours actually before this happens. The symptoms, they do appear rather quickly, but they can last up to several days actually. People can have issues like flu-like symptoms, body aches, muscle aches, fever, chills, headaches, you name it. Sort of feel like foggy, hard to focus at work, kind of irritable. Sometimes allergic symptoms also, like nasal congestion, like runny nose. You can have some sneezing, sometimes itching, all of that stuff. I've also seen some GI symptoms where you can have like diarrhea, bloating, a little bit of abdominal pain. Could develop a rash on the skin, the face can all appear red. So all these very weird non-specific symptoms can appear. We don't really know what causes it, to be honest. There are theories that there could be an allergic or autoimmune response to the production of semen or like to sperm, but we're not sure about it. I was asked if females can develop it. This was one of the questions. So I mean, it's possible, but most of the data actually comes from male patients, so I'm not aware of a female is developing this, but I could be wrong. Now, a patient said hey, could I? What if I just stop masturbating or stop having climax? Would this help? So it can, but again, at the same time, the symptoms can happen after masturbation. Sometimes people can have wet dreams. So avoiding this generally is difficult to do, especially for young patients, right? Because most of POIS or POIS can actually happens in during teenage years. When the sex drive is high, we're sexually active. Um, so this is definitely a problem, for younger men. In order to diagnose this, unfortunately, there's not a single clinical test. It's all experience, and you look at the symptoms, you look at the timing. We do look for some specific blood work. I always check an autoimmune panel, thyroid, testosterone levels, C-reactive protein, ESR. All those things can help me how inflamed the body is. Um, I was asked, what if I have low testosterone? Could it cause POIS? So just having low testosterone doesn't mean that you could develop this, but men who do have POIS, they tend to have low levels of testosterone. So it's possible, the theory is that when our testosterone levels are low, we have overactivation of T lymphocytes, which are our immune cells. So you could have a higher incidence of autoimmunity, right? So naturally, people who or men who have low testosterone have a little bit higher rate of this syndrome. And also the other thing is that when we actually do increase the levels, for testosterone, I could be ashwagandha, shilajit, zinc, boron, all of those things, adrenal support vitamins, HCG therapy. The symptoms of POIS actually do get better. So there is definitely a link somewhere, but how much these two things are related to each other, we actually don't know. I had a question on one of my blogs to see if because sometimes men are just so tired of this affects their quality of life so much that they are consider getting vasectomy. So I was asked, if I get a vasectomy, would this help? So unfortunately, it does not, right? So because this is sort of a hypersensitivity to the semen, and semen is produced primarily in the prostatic tissues, so just having a vasectomy will not actually help with the symptoms. So don't do that for this reason. I mean, if you're going to get a vasectomy, get it for other reasons, but not for this, right? Lastly, like, how do we treat it? So unfortunately, no cure yet. There are some strategies you could use to kind of reduce inflammation and allergy. So, generally living a healthy lifestyle, exercising, eating less processed foods. We will sometimes give, Benadryl, antihistamines medications, right? The fexofenadines, the diphenhydramine, also called as Benadryl. The problem with those is that the dosing I have to use sometimes is quite high, and it just make people very sleepy, and they don't like it. It causes a lot of dry mouth. So there are definitely side effects with this. Sometimes I have used steroids, honestly speaking, but I use a very low dose. If I do, it's for a very, very short period of time because the side effects are so high. So I generally will do a quick trial, but this is not something I condone long-term use of steroids at all for this condition. We do a lot of testosterone boosters. At CG, I'll give them ashwagandha, boron, zinc, adrenal support vitamins. And other option to use is actually called clomiphene citrate. It's a tablet you take every day, generally about 25 milligrams. Tends to boost LH levels, luteinizing hormone, which in fact raises testosterone levels. So it kind of helps with the symptoms. You can also use SSRIs or other antidepressants, because most SSRI or other antidepressants, they really suppress our sex drive. They make it really, really difficult to climax or orgasm. So it may help, right? It may help, but most men say, I don't have any sex drive. Sexual symptoms are so bad, especially these are younger people we're talking about. So this also kind of creates a problem, the lack of too many side effects with too many side effects with SSRIs. The other option is to do just do testosterone. Especially if somebody's levels are really, really low, giving them testosterone could be an option. Now, I never use testosterone in somebody who's young and has not completed family. The reason for that is that when we do inject testosterone or get testosterone from external sources, it suppresses our luteinizing hormone, sometimes FSH, so it causes atrophy of the testes. So the testis becomes very small, and the sperm count goes drastically low. So people can have fertility issues. So I'll always tell before you do testosterone, make sure you freeze your sperm or you complete your family. Otherwise, I do not recommend using testosterone therapy without. Now, there was a new treatment that I came across. It's monoclonal antibodies. We're using them for everything these days. So omalizumab, it's a monoclonal antibody. So it's been approved for use in allergic asthma, since POIS is also allergic disorder, so kind of made sense to kind of try it there. It can also be used for any food allergies, and it lowers the IgE levels. So that's the antibody that actually causes a lot of allergic issues. And it downregulates mast cells. These are the cells that produce histamine and cause the runny nose and all the allergy symptoms we get. Could cause rash, urticaria. So that's how it works. So since POIS, we think it is because of an allergy issue, so it makes sense to give something like this. No clinical data, mostly case reports, very here and there. It is a new medication. Your insurance is not going to cover it, unfortunately, for this, because again, they'll say there's no data. You have to inject it once a week. The cost without insurance, unfortunately, is prohibitive for most patients. $2,000 to $3,000 a week. That becomes definitely problematic. So in summary, what I would like to say is that post-orgasmic illness syndrome, or POIS, is definitely a real disorder. Talk to your provider about it. And if you're a provider, definitely don't dismiss your patient's concerns, because this is a real thing. And there are strategies you can use, like we talked about some medication. Definitely work on boosting your testosterone levels. Don't smoke. Don't use cannabis or marijuana, because it suppresses testosterone levels. There's a video actually I made on it. So try some of these strategies, see how you do. Think of clomiphene citrate, think of adrenal support vitamins. But all in all, there is unfortunately no cure for it, but it certainly can be managed. So I hope I was able to shed some light on this topic. If you have any questions about this, go to healer.com. There's a blog there. Put some comments there, and I'll be happy to respond to it. And if you do like the content of this video, please do like and subscribe, because it keeps me motivated. Thank you again. This is Dr. Raj Singh from Las Vegas. Bye-bye now.